do it all.
Okay. Yeah, yeah. I've seen your profile and you've been a great student, like from your UG days, or like.
Yeah, I suppose you like through your Insta, I can see that you are also reading very nicely.
Okay. Okay. Thank you. First of all, thank you for joining, and it's a pleasure to having you here.
Yeah, it's my pleasure too. So we
And
have like a few people.
hello, hello, everyone.
Okay, so somebody who's recently joining, who's just joined the live or maybe for the first time.
Yeah, yeah.
We guys are
Okay.
doing live, so in case you have any question for FMGs or for MBBS students or about residency or skincare or something, so we are going to talk to you for like 10-15 minutes and then we'll carry on with the work. So what were you doing right now?
I am just in library and
Oh,
just
okay,
waiting for
okay,
this live only.
okay. How is your library? Can you just show us around?
It's
And what are you
actually
reading? So we'll
I'm just
start.
start reading ENT computers and
I think we'll start the discussion with the subject you're reading and then maybe questions will pop up to answer those.
yeah, yeah. How is your residency going on? Like nowadays, people think that PG is very toxic or like hectic. In
Yeah,
same Dharma, how
I
is
also
Dharma like?
I also
School
agree to
or
that.
like very hectic or toxic?
Yeah, because we see so many cases, recently there was some pediatric resident in Bhopal who committed a
Hmm.
suicide, and then
Yeah,
we heard about a resident getting stabbed in some part of the country.
yeah,
So I think residency in general is a very tough place, but Dharma makes it light. That is one thing, and also like we read a lot, but we do not know a lot about public dealing. So to deal with
yeah,
seniors, to deal with juniors, and to deal with patients and all, this is something. Residency is a very big learning experience that way because you start learning a lot about dealing with people.
mm,
So that is the thing. In case like you have a good internship experience, or in case you have worked somewhere before you join residency, you'll find it easier than a lot of other people. But in like overall, I feel that residency is a place where you are like a government employee with a fixed salary, so they want to extract maximum work out of you, and it sometimes becomes too much. Um, so yeah, I have like we were thinking of making a few videos on how to cope with residency stress and all also, but I think I'll do that sometime later because I'm making a
yeah.
lot of content. So final year I think is also very hectic. There's a lot to read. What all subjects do you have in Russia? And one question I was thinking like, why don't people who are like, why don't FMGs do post graduation in that particular country only?
I think that's not valid in India. Only MBBS we can do from some specific countries.
No. Like, don't you think that you'll get better pay scale and all of that if you work in Russia itself? Because a lot of people who study here go outside. Now, the people
Yeah.
who study outside, I don't see a reason why they should be coming back.
Okay, I'm telling you the reason. Actually, it's it's been like 6 years for me being in Russia. So nowadays I think like most of my friends or I am like कि बहुत हो गया मतलब 6 साल बाहर बाहर रहना फैमिली से it's like difficult for us. So my thinking is like कि अभी आगे से इंडिया में ही करना है जो भी करना है.
Acha, because
Yeah,
staying away from here all is difficult.
yeah,
But other ऐसे वहाँ पे do you guys get jobs? Do you guys get post graduation once you pass out?
yeah. Some do post graduation from here, and um, many of us, like many FMGs, like don't do post graduation here. Like they prefer to do in India because
Yeah,
वही reason है कि
that
हाँ बहुत
see
रह
the
गया
trend.
बात.
People want to come back and do post graduation here,
Yeah,
and
most of
some people do really well also. So I wanted to know the reason. I think now it's very clear.
yeah. That's only reason. It's very difficult to live here. Like starting it was like fun. Yeah, मजा आ रहा है सब कुछ. And later it became like doing all the stuff from like ourselves is not easy task. और ऊपर से इतनी ठंड है like everything changed. That's it.
I it, can be difficult, and also because you can't travel a lot. I also met this like girl through my IG lives only. She did her MBBS from China, but while she did that, she also did a part-time job, and she said she made a lot of money out of that. So maybe you guys can explore that option also, because countries like Russia, they have all the machines, they have all the buildings, but they do not have manpower.
Yeah, very less manpower.
Mm,
Population
so
is
like,
so low in compared to India.
okay, okay. I don't see why the like people interaction is less. People are not joining at all. Is it like a private life or something?
Don't know.
I don't know. I don't see a lot of people joining in. Anyways, so
Let's
yeah, you
let's
guys can like talk with us.
now. What's your future plan like after MD in Dharma? Like,
I think I was like very since like after I took the NEET PG 2021, it was like they didn't really have an exam for 8 months, and it was so extended, and then the counseling didn't happen for 6 months. So I am tired of waiting. So I don't want to take any more exams. That is for sure. And I am in a branch where that is not necessary. So
yeah,
firstly, I would not like to take a lot of exams, although I don't know how I can stop myself from doing that. Always keep searching like the exams and all that you can take after dermatology, and I keep asking people if there are any such exams. But personally, I feel that it'll only be good if I stop doing a lot of that. And also, like, I wanted to do derma because I wanted to give time to my hobbies and all of that. And making content is one of those things that I wanted to do. So I have not been making like since a long time. I've not been making content. I just started making content regularly since the past 5 4 months.
yeah,
So, but it has been like I have really been enjoying it. If I could, I would like do content creation full time.
yeah. That's
And also like I want to know my subject well and practice dermatology somewhere. That is all I plan for my future. After COVID and so much uncertainty, I do not believe in making long term plans anymore. So I try to live in the moment, and I try to read, and all that I visualize for my future is, I'm making content somewhere, and I'm also seeing patients, because seeing patients, it gives me immense satisfaction.
yeah. That's the biggest satisfaction you get in your job life. Seeing
Yeah,
patient and
when like when people come back and then they say that sometimes when people come back they say ki, the cream that you gave, it healed my lesion in 1 day. So it's like a very good thing to listen from people.
yeah,
So that and
and
baki
like
हाँ बोलो बोलो.
uh, how's like Dharma? You get enough time for like other activities, like you are making content on
Yeah, I
Instagram or
think
like various
all the other,
companies.
yeah, compared to all other branches, this is probably the only branch where you can also like make content, read, sleep, and do your duties in the same day.
Yeah,
So,
that's why many people prefer to have like Dharma and this kind of
radiology.
branches. So
I but
yeah,
personally, I think,
radio.
yeah, personally, I think radiology is a very hectic branch. Although I have not like had any duty, like I have not worked in a radio department to be honest, but from what I've observed, like you have to read a lot.
Yeah,
Firstly, you have to know a lot, almost everything about all the 19 subjects. So everything comes down to the investigations and all. So that thing, and also like the duty hours and all, and also like emergency CTs, emergency scans, it is upcoming. I think like in a few years from now, radio will also become a very hectic branch.
uh,
But
and
even
ortho and surgery.
like
Yeah,
it, I find it a very theoretical branch. So I wanted to do something different, and I always wanted to do derma. I wanted to do
okay. So is
peds.
there any emergency cases like in Dharma?
There
You
are
get
a
any
lot.
emergency cases?
There are a lot of emergency
Most
cases
of would
that we,
be like burn or like something
yeah,
else.
drug reactions like SGST and
STD
SGST,
burn.
yeah, and then sometimes like all erythrodermas. So any skin condition that you normally see, they can involve a lot of body surface area, and once they involve like more than 90% body surface area, it becomes erythroderma. So all erythrodermic, so you can have pemphigus, you can have psoriasis, all of them can convert to erythroderma, and then it becomes very significant, because if more than 90% of your skin barrier is damaged or it is involved due to any of the diseases, what happens is you lose a lot of water, fluid, electrolytes, and all of those things. Patients can go into hypothermia, they can go into shock, and electrolyte imbalance is also there. So it becomes like an emergency only after that.
Okay, that's great.
So how are the people there at your place, like in Russia, if you guys stay?
Like
So
people
how
are
are the
very calm and like silent. They don't like they वो अपना काम से काम रखते हैं, like
professional sort of?
professional sort of, and they are very less talkative and
Yeah, I think that is why people must be missing home and all. क्योंकि अगर
yeah,
मतलब लोग
that's why yeah,
फ्रेंडली होते तो फिर इतना नहीं लगता, बट ठीक है.
हाँ
It
वही
is,
तो बाहर भी बहुत अभी तो वैसे भी विंटर है तो ज्यादा ही लोग बहुत कम लोग दिखते हैं बाहर भी
population is less in all other countries. No, India is full of
yeah.
people.
That's the main factor.
Yeah, but I
And in
think you
hospital
should.
also we get like less patient in compared to India. Like बहुत कम लोग बीमार भी पड़ते हैं due to like healthy lifestyle और
Yeah, I can understand. I have friends who are working in UK. They also say the same things. But personally, I feel like if you want to come back and all, there are plenty of things that you can do once you come back. So like
yeah
even if you get an MD, I think personally that DNB is almost equivalent, but you should try to get it as fast as possible so that the entire stress around this thing is less. And also I think because when you're a fresher, your hard work and your passion, or like the amount of effort that you put into getting it is more. And
yeah
that,
we all uh, because we
yeah,
already preparing for like MCI or FMG,
yeah,
so like 80
yeah, and
70
also
to 80% of the syllabus is the same as the PG level.
yes, and you also read about like this thing. For your FMG exam and final year exam and all the board cases and all of that. So I think it's a great opportunity for you. Like when you come back in your first or second attempt, because you have to do a compulsory internship also.
Yeah,
But try to find a place where you do not have a lot of work to do, and then prepare for the exams side by side and pick up whatever you get. Like try to do your
yeah,
best, even if you get DNB, or if you get, I would say, DVL, DMRD, or no diploma any in pediatrics or medicine or anything. It's better than not doing your MD and just sitting idle at home, and your efficiency also decreases. And if you put yourself that pressure, I have to pick up a seat in this attempt, then you give your best. So tell yourself that this particular attempt or this time around it's going to be my last attempt and all, and I am not going to put in more effort after that, and then just pick up whatever you get.
yeah,
When you will have the pressure picking up whatever you get, you'll automatically start reading more.
yeah. Okay, so we have like you as a dermatologist, so it's winter season going on, so some skincare tips to people like
Yeah, I keep
how they should.
that up. So in winters we mostly get dry skin because the weather is such that there's a lot of water evaporating from the skin. It's already dry, the air is dry, so it takes up water from your skin. So your skin also gets dry, flaky, and when it gets dry, it gets itchy. So I would say that you should use moisturizers as much as you can, and sunscreens. Somebody was asking me like, can you use sun? Do you need to use sunscreen in winters? See, what I think is you need sunscreens in winters. At max, you can use like a lesser SPF, or rather than 50, you can go for 30 also, because it's winters. But you do need protection from sunlight, because sunlight is very much there. Even on cloudy days, we say sunlight is there. So why not in winter? So I think moisturizers, sunscreens, these are the things that people should very readily use. And like other than that, it's on you. If you're a girl, like you would probably want to use all of those in things like retinol, vitamin C, blah 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 blah. So it depends on you. You're also getting like we are also crossing 25, 26 years of age, so we are also getting old and all. And I think not this, but hair fall is something that like all students are very worried about. Like everybody who I talk to comes to this every life that I do. There's somebody asking about hair fall.
Yeah,
So for that, like, you might have dandruff and also you can change your shampoo. But in case you have hair fall, first thing is like focus on your work and don't worry too much about that because you have your lifetime. You should focus on your exams, but you can take hair supplements, you can change your shampoos, conditioners, and you can do basic things, basic hair care like combing them nicely, keeping them oiled. I don't know why people think that oiling is not good and all, but I personally think, and I've read this in my textbook also, like oil is like a conditioner. So it will
yeah,
protect your hair from UV damage, pollution, and all of that. So if you want good hair, you can oil them. You can take supplements. You can change your shampoos and all of that.
yeah.
I
And also,
don't get it why people are not joining in.
yeah, I'm surprised. Like only very less
And
people are joining.
I'm also surprised like the people who have joined are not leaving also. So
What?
there is a constant number of people who are there in the live 25, 26 people.
Yeah,
So that is,
I think some glitches there.
yeah, I think so too.
I think very less people like 17, 14.
Yeah,
Don't know why.
if you request or something, you can add people, or maybe we can do a live again someday. So that
Sure.
maybe I think it's about the timing also. 6 is not a good time. People are not
Will
very
we have a like proper schedule for the live,
yeah
a
proper
proper
live like
planning?
yeah around
It's a random kind of live, so
and
people may not
around
know about the live session. That's why.
yeah and around like 10 o'clock according to Indian Standard Time because that is the time around which people are mostly active.
Okay. So from audience, any questions?
Yeah, we'll
Yeah,
end
from
the live otherwise, and
yeah,
because I
Doctor
think you
will making in the house.
not
Hi,
just
hi, hi.
you must be having a lot to study. So
Yeah,
it must be like it must be a lot of work. You guys have internship or not
we have a
after your
rotation shift, like rotation shift. Uh,
okay?
we generally have like clinical exposure with general classes.
So are you not planning to give any of these exams, PLAB, USMLE, or any of these?
No, I, I'm not. I'm not gonna give like because the same reason I've been like
Then you
actually
should definitely prepare for your NEET PG along with.
yeah like
Okay,
okay, okay,
it was nice talking to you. We'll do it again someday because this time I think it didn't
okay,
show or
okay.
something.
Yeah, one of my friend asking like how to manage all 19 subject for revision. You are the best one to give answer regarding this question. Like how did you study actually? What was the
I
planning
say that
and everything?
you make a basic set of notes. Okay, it'll keep your anxiety away. So we have ready-made notes and all also. So just keep going through them. Do a lot of previous year questions and keep a small copy with you for all the things that you can't remember and keep revising them. For that you can also do it with a friend of yours or something. So just keep 1 hour or 2 hours in a day for making mnemonics or for reading things that you can't remember. And I think making notes will help. Making notes and also like focusing more on the previous year topics. If you are preparing for NEET, do the previous year questions along with the notes. If you're preparing for your final MBBS exams, again find the previous year questions because once you know like 70-80% of the important questions, you'll be so much at peace that you'll read the rest of it better. So firstly finish the bigger chunk. Like sit and read for 15 days and finish off all the important things, all the things that you think might come if the exam was held tomorrow or if the exam was next month. Think of the 15 in 15 14 days try to cover all the things that you think might definitely come. So going through previous 4 or 5 papers will help you, sort those things out. So finish off the important things first, and keep revising whatever you feel you'll forget. keep jotting them down in a notebook or something. Some people make flashcards, people use Anki. There are so many other flashcard apps, so you can use them. They'll help you a lot. And just keep reading. There's no other way to do this thing. You
Okay.
have to be very be like try even if you're not able to bring out your best output, just try to sit through the day and try to read however much as you can.
And any specific for like Dharma, how to study Dharma, according to you?
I think Dharma is a very visual branch, so I don't know how I did it then. But if I were to read Dharma all over again, I would just pick up previous year questions and see a lot of images. And I would keep them at one place. So I will probably make my personal notes, and I'll do a lot of questions from all places like INI questions, NEET questions, even the previous PGI aims if I have to do. Like earlier they used to have those exams. Although I will not recommend that because that wastes a lot of time. A lot of old questions are not repeated. The pattern changes every few years. But pick up all questions if you see, INI is held every 6 months. So even if you try to do previous 5 year questions, it becomes like 10 INI papers and 5 NEET papers, and it becomes a lot. If you sit and start doing it, it becomes a lot. So
Yeah.
I would just pick up previous year questions, make my personal set of notes for the year 18, 19, 20, 21, 22. I would make my personal set of notes. And in those notes, I would keep adding every other question or every other important thing that I had to read. See, suppose I was doing surgery module and I saw something which was derma questions, I would add them in my notes and I would make them very visual. So I would see a lot of Google images and I would keep them there because you can't remember Dharma
Yeah.
just by reading it. And in case like you
I'm
have any for anything or you need mnemonics for anything, just DM me. I like doing that. I read with my interns every day, so you can do that too sometime if you want to.
Thank you.
Okay.
No
Okay,
question.
so I think
I think yeah.
there are. Yeah, so we are there for like 1, 2 more minutes and then we'll call it a day.
Okay.
So anybody wants to ask anything, we're
So
here for one
anything,
more minute.
yeah. Anyone wants to like want to ask some question? Please send it again. Like I think आगे चला गया हो.
और मतलब in my screen तो there is not much being shown, so I don't know, probably.
Yeah, same. I don't know. Like less people join.
Okay, no problem. So we'll
We'll
do it.
like do later. Like
Yeah,
again.
sure, 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 sure. Okay,
So
bye.
thank you for joining.